There are mounting concerns over the slowing pace of vaccinations in the U.S. So far, almost 64% of adults have gotten at least one shot. President Biden wants that number up to 70% by the 4th of July. Experts worry the country won't reach that goal, partially because southern states are lagging. Janet Shamlian reports from Houston.
The president's drive to get 70% of Americans vaccinated by the 4th of July is hitting roadblocks, even with million-dollar lotteries and free beer. In a handful of states, mostly in the South, fewer than half of adults have had a shot. The rate's so low, it would take Mississippi more than a year to reach the 70% vaccination goal, and 2.5 years for Alabama.
Vaccine rates in much of the South are low. What are the consequences going into fall if they continue to stay low?
It's not just that they're low, they're really low. If you remember this time last year, we were looking pretty good. And then we saw this massive surge. And I worry with the low vaccination rates in the South, we could see something like that again.
The hesitancy includes hospital workers. A USA Today study found workers fully vaccinated at the nation's largest hospitals range from 91% at the high end to just 51%. Houston's Methodist says its rate is 99% for its 26,000 workers across 8 campuses. The hospital is requiring staff to be vaccinated by midnight or risk losing their job.
We have incredible real-world experience to show that these are safe and effective. And we're in a pandemic here, and we are a hospital system that cares for vulnerable people.
More than 100 employees have filed suit against the hospital, including nurse Jennifer Bridges.
Why have you decided not to get vaccinated?
There's not enough research on board. It's not fully FDA approved. It's still experimental.
Well, frankly, that's a nonsense claim.
Jennifer Bridges says she won't change her mind, and tonight will be her last shift.
The federal government recently updated vaccine guidance for employers, saying they could require staffers to be vaccinated, but had to allow for religious and medical exemptions. In terms of this case, it could soon be decided in court, possibly setting a precedent for the rest of the country. Elaine?
Janet Shamlian, thank you. For more, let's bring in Dr. Shad Marvasti. He's an emergency medicine physician and the Director of Public Health, Prevention, and Health Promotion at the University of Arizona College of Medicine in Phoenix. Dr. Marvasti, welcome. The slowing pace of coronavirus vaccinations across the U.S. is threatening President Biden's July 4th goal to have 70% of adults with at least one shot. What do you think is driving this drop in numbers, and why are we seeing some states further ahead in their vaccination efforts than others?
Well, unfortunately, we're seeing that the main driver seems to be along political lines. We're seeing a number of folks who, from the Kaiser Family Foundation vaccine monitoring, they found that there's a percentage of people really on political lines that are just refusing to ever get it. And we're seeing that play out around the country. Fortunately, there's also a percentage of folks who are kind of having that wait and see approach, as was mentioned in the earlier clip, thinking that we're still in an experimental phase, which we're really not. And those are people that I've encountered. And really, I think those are the folks that we really need to focus on in terms of our efforts for education and promotion of the vaccine to get them to kind of cross over and get vaccinated to protect themselves and protect everyone.
Well, some health experts are warning the southern U.S. is at risk of another possible coronavirus surge in the coming months. How concerned are you, doctor? And if it were to happen, how bad could it get?
I am concerned because there's a good chunk of folks there who are not vaccinated. I think right now we have a false sense of security because you're seeing the numbers even in those states currently low, probably because of the combination of people who've been vaccinated and the large proportion of folks who have natural immunity, either through asymptomatic or symptomatic recovery from a COVID infection. As we know, the numbers that we have of 33 million plus underestimate the true number of folks who've been exposed and overcome. And so we have a lot of people who have that natural immunity, but we know that if they get vaccinated, they have 10 times increase in antibody levels and their immunity lasts that much longer. Versus the waning immunity, which will come in the fall. So I am very worried for that population in particular, and also because of the fact that that can lead to the formation of new variants, which would be resistant to our vaccines and then cause problems for the rest of the nation.
So let's talk globally here. Secretary of State Antony Blinken says the U.S. will distribute 80 million vaccine doses to other countries by the end of July. Now, some critics argue this isn't a big enough contribution. Do you agree? And where are those doses needed the most?
Yeah, I'm afraid that it may be a little bit too little too late because of what we're seeing in India and in South America and other parts of the world and the developing nations. It's a great effort to start, but we really need to be doing much more. And definitely the U.S. needs to take a leadership role, but I think all the other wealthier developed nations need to kind of combine efforts along with the, pharmaceutical industry that's manufacturing these vaccines. Because if we don't get a handle on it globally and see ourselves really part of one family, kind of really dealing with this in a global village sense, it's just a matter of time before variants like the Delta variant becomes something that poses a threat to everyone because there is always a chance that a variant could form that would be resistant to all of our vaccines and would be upgraded from a variant of interest or concern to a variant of high consequence, according to the CDC, which would basically mean that the variant would be higher in transmission, infection, and death, and resistant to our vaccines. And so we don't want to take that chance, and that's why we really need to care for everyone around the world and do much more than just 80 million.
And Doctor, the former head of the FDA says officials need to take a, quote, broader view in their investigation into the origins of the virus. What exactly does he mean, and what questions need to be answered?
I think that's an accurate statement because I think it's not just a question of science. This is a geopolitical question and also a question of national and international security. For the global commonwealth of the world in terms of all the nations kind of to look at this together. And we have to examine it from multiple angles. There's a scientific question of whether or not this could have been manufactured in some way or not. But then beyond that, we have to look at the telltale signs in terms of what kind of cover-up, if any, has been in place, and what are the other contextual factors involved in terms of whether or not there was a potential leak, inadvertent as it may have been. It may be completely innocent, but it still needs to be discovered, and we really need to be focusing on the truth. And to get to the truth, you can't just limit yourself from one perspective, right? Biology is one perspective, politics is another perspective, and understanding the interplay between them is this complex reality which we face with something like the global pandemic of the novel coronavirus.
Finally, you mentioned India a moment ago. India's government has begun easing restrictions. Daily infections there reached their lowest level in 2 months. But given how dire the situation was there just a few weeks ago, do you believe this is safe?
I do not believe it is safe. I believe it is premature. And the reason for that is, one, it's really too soon because we don't have a full understanding of all the variants and also the points of transmission. The density of population, again, present itself. We really need to have a phased reentry that would be much more gradual. And then really the main reason is we don't have enough of the population in India fully vaccinated. I would consider something like that to start after we get over 50% mark fully vaccinated, and then also be tiered and phased, really watching and seeing what happens with 2 to 3 week intervals, which is what we know of the timeline of the virus. And so at this point, I think it's premature and dangerous.
Yeah, what you're describing sounds like a very precarious situation. Dr. Shad Marvasti, doctor, thank you very much for sharing your expertise with us.
Thank you, Elaine.